Welcome back, everyone. This is the Clear Strategy Legal Nurse Consultant. Today, we're diving into a heartbreaking and controversial case out of Georgia. This case involves a woman who is brain dead and pregnant. Her name is Adriana Smith. She's a nurse, a partner, a daughter, and a mother. This case is raising serious legal, ethical, and moral questions. As a nurse and a legal consultant, I felt called to talk about this. Let's break it down. Adriana Smith is a 30-year-old African-American woman who was declared brain dead after a medical emergency. According to Online Athens, she was nearly 9 weeks pregnant in February, and she started to experience some intense headaches. According to her mother, April Newkirk, this was also reported to the Associated Press, she went to Northside Hospital and was sent home with some medication. They don't really specify what medication she was sent home with, but she was the first time that she went to the hospital. The next morning, Smith was gasping for air and making a gurgling noise in her sleep, so her boyfriend called 911. According to 11 Alive, Smith was taken to Emory Decatur and later transferred to Emory University Hospital, where she worked as a nurse. A CAT scan revealed multiple blood clots in her brain. She was eventually declared brain dead and has since moved to Emory Midtown. Newkirk said her daughter has since been kept on a ventilator with the plan to keep her on life support until at least 32 weeks of gestation, when the fetus has a better chance of survival outside the womb. The doctors were reportedly unable to consider any other options due to Georgia's abortion laws. That's what's being reported by Online Athens. Well, at this point, I just want to take a moment to talk about two separate things. One is this law in Georgia known as the heartbeat bill that everyone is referencing about this case. And I also want to define the term brain death, because there are some people who may have heard it but not really understand what that means. Georgia's heartbeat bill is a 6-week abortion ban, except in certain situations, physicians practicing medicine in the state of Georgia would be prohibited from offering abortion services to pregnant women if a fetal heartbeat is present. This typically occurs in the 6th week of pregnancy. Exceptions are provided for women whose pregnancies are considered futile, meaning anencephaly, no brain in the fetus, or medical emergencies in women pregnant by rape or incest, but only if they are less than 20 weeks pregnant and only if they have filed a police report. Now, originally, this bill was formally named the Living Infants Fairness and Equality Act, the LIFE Act, and was an anti-abortion law passed in 2019 that sought to prevent physicians in Georgia from performing abortions beyond 6 weeks of pregnancy. Exceptions were in special cases, as we talked about before, if the fetus was developing and didn't have a brain, things like that they would grant the abortion. Now, this bill was strongly criticized. Nonetheless, this bill passed in 2019, and it was initially ruled unconstitutional in July of 2020, but that ruling was reversed in July of 2022. Many people who are against what is happening to Adriana Smith right now often references this bill, so I just wanted to lay a framework so that we're all talking about the same thing and have an understanding of what the bill says. Now, in terms of brain death is also known as brain stem death, and this happens when a person is on artificial life support machines like ventilators, medications, and things like that, but mostly a ventilator. And their brain has no way of recovering because there's no brain activity, there's no brain function. A patient will not regain any consciousness or be able to breathe without the support of a ventilator ever again. A person who is brain dead is legally confirmed as dead, and this is a process in different hospitals. I'm not for sure if it's exactly the same in every hospital, but from my knowledge and my experience, this process takes some time, depending on how what we call anoxic event, so an event where the brain is not getting oxygen. We use a procedure called therapeutic hypothermia. Therapeutic people will know it's something that helps you to get better. Now, the hypothermia is low temperature. So we purposefully put the body under a low temperature for 24 hours, and then we do a rewarming period after that 24 hours to see if we have any brain function. But don't quote me, this may not be in every single hospital, but this has been my experience with this. This also depends on when the person was found down, how long they were down for, and the hypothermia period tries to preserve any brain function that the patient might have while the body is recovering from having this anoxic event. Once the body is rewarmed at a certain temperature for a number of hours, neurologists or brain doctors, nerve doctors, they will come and do extensive testing on the patient to see if there is any brain function. So it can be, but it is not limited to what we call EEG testing, where we put like the stickers around the head like we do for your chest to monitor your heart rate to see if there's any brain activity. Even if the person is not moving, maybe there's something happening in the brain. They do this for a number of hours as well, and they confer with different neurologists to look at the readings to see what each one sees, because declaring someone brain dead is very serious, of course we know, but it's a procedure that takes a while to make sure that we are not missing anything and that we've tested every possible way to see if this patient will have a recovery period after this event. So the EEG monitoring, the stickers around the head, as well as neurological exams spaced out at different times, just to make sure that this patient has had the same evaluation. It's been 24 hours, 48 hours, 72 hours apart from it, depending on what the practice is at the different facilities, to make sure that there is no changes before someone is declared brain dead. Now, the issue with this is when Ariana went to the hospital the first time, she was complaining of headaches. She was sent home with the medication, but there was no further testing done. The standard of care, standard of practice is if there is recurrent headaches with no etiology or cause, we try to find out what the cause is. A brain CAT scan would be one of those things. Also in this situation, we know that this patient is pregnant. There may be someone deciding if the risk outweighs the benefit, but in this case, we can clearly see that if Ariana had a head CT, this would have been caught earlier. I can't speak to what the outcome would have been, but this issue that she had would have definitely been caught earlier. Now, I saw 2 different interviews from the family, from her mother in particular, Miss Newkirk, and she was explaining that her boyfriend, Ariana's boyfriend, was asking for Ariana not to be released from the hospital because of the headaches. Even with this asking, and this is all being reported, so I'm just, saying what was reported in this case, she was still discharged home. Then when she went back to the hospital and they discovered that she had these blood clots, this is definitely an emergency. In the case that you have a brain injury or brain blood clots and things like that, sometimes there could be swelling, definitely a blockage of blood flow. So that's a decreased flow of oxygen as well to the brain, which caused this anoxic event. At that time, the doctors were saying, well, we need to release the pressure. They didn't specify what procedure. There's different procedures that can release pressure in that if there's increased pressure in the brain. But when they went to do the procedure, it was reported by the mother that they came back out to her and said that there was nothing that they could do. Hopefully you all are still here with me in understanding the terminology, the basis of the case, the definition of brain death, what the bill actually stated. Next, we're going to look at 2 different clips from Ariana's mother, explaining what their experience was as a family throughout this process, what's happening now, which is what everyone is speaking about. So I want to play the 2 different clips, and then I'd like to speak about them. They sound a little bit different in what the experience was, which to me may notate that these were taking at different times of the case as things were happening and progressing, as the family is getting more information. So we'll see what their experience was in their own words.
30-year-old Adriana Smith was about 9 weeks pregnant when she started having bad headaches in February.
Enough to know that something was wrong.
April Newkirk says her daughter went to Northside Hospital for help.
They gave her some medication, but they didn't do any tests. They didn't do any CT scans. If they did, they would have caught it.
The next morning, Adriana's boyfriend noticed something was terribly wrong.
She was gasping for air in her sleep, gargling. More than likely it was blood. She was taken to Emory, Decatur, and then she was transferred here.
To Emory University Hospital, where Adriana worked as an RN. Unfortunately, there was nothing doctors could do.
They did a CT scan and she had blood clots all in her head. So they had asked me if they could do a procedure to relieve them, and I said yes. And then they called me back and they said that they couldn't do it.
Doctors declared Adriana brain dead.
I feel as if somebody dropped the ball at the hospitals, and her boyfriend asked, please keep her. If she was kept at the hospital, we wouldn't be here. It's torture for me. I come here and I see my daughter breathing by the ventilator, but she's not there. And I'm touching her. And she has a son. She's pregnant with my grandson, but my grandson may be blind, may not be able to walk, wheelchair bound. We don't know if he'll live once she has him. It should have been left up to the family, because I'm in my 50s, her dad is in his 50s, so we're gonna have the responsibility with her partner to raise her sons, you know? And I'm not saying that we would have chose to terminate her pregnancy. What I'm saying is we should have had a choice. We should have had a choice.
Adriana Smith is 22 weeks pregnant.
But she's not there. She's not there. But the baby's there.
April Newkirk says her daughter was declared brain dead on February 19th. Adriana was 8 weeks pregnant.
We wanted to know if she was to abort, would she have a chance at her life? And they said there was no chance. So at that point, we continued with the pregnancy that we didn't have a choice or a say about. And I just want to be clear on something. We want her to have her baby. We want her life to continue throughout her children. But at the same time, to see her lay there like that, for that length of time, the grieving process for us, it can't even start, because every time we go, we grieve and we hurt. And it's just unreal. It's unreal for anyone to go through this. The baby is the right weight, a little bit over, which is a good sign. He has his legs, his toes, his limbs. Heartbeat is good and strong. It's just maybe because of the loss of consciousness with my daughter, the lack of oxygen that the baby didn't get. So that's where the cerebellum comes into place.
Baby Chance's future is still uncertain.
So the journey is for baby Chance to survive, and in whatever condition God allows him to come here in, we're gonna love him just the same, and we're gonna embrace him.
Listening to Adriana's family explain their experience during this entire case, it truly, truly breaks my heart. I think about Adriana in the sense of being a mother myself. I think of Adriana as being a sister, an aunt, a daughter. And if I were in that situation, what our experience would be. And it just is something you can't really fathom for yourself. You see it playing, in the media, but this is such a hard, difficult case. And I pray for her family and hoping that they get through this without too much interference from outside voices, with help, hopefully being treated with love and grace and respect. So I just pray for their family. I wanted to say that first and foremost. Really quickly, I just want to talk about the differences between brain death versus someone needing extensive medical treatment to survive. In terms of brain death, there is no brain activity. There is no chance of recovery because there is no brain function. Any movement that the patient is doing is because of a spinal reflex. So there's no chance of recovery in that situation. In terms of someone having an extensive medical event and needed an extensive medical treatment to survive, they do have brain function, even if it's not 100%, and there could be chances of recovering depending on what their injuries are. So that's the biggest difference. I thought of this case, and then I thought in terms of an advance directive, which is a document that you can fill out while you're alive and well, stating the things that you would want in case you couldn't make decisions for yourself. Some of the big things that are on an advance directive focuses on if you want CPR or not, if your heart was to stop. It also focuses on if you would want a trial for a feeding tube, no feeding tube, or long-term feeding tube for treatment. If you would want to be on a ventilator to breathe for you in the case that you couldn't breathe for yourself. And if you would want antibiotics to save your life in the event that you had a really bad infection. Those things would be on your advance directive so that anyone who sees it would be able to know what your wishes are if you couldn't speak for yourself. In Adriana's case, my first thought was if she had an advance directive, that would have cleared up so many of the unknowns as to what she would want for herself and her baby. In the terms of being brain dead, an advance directive doesn't cover you because you are legally dead at that point. In the case that you have a brain injury or an extensive injury where you couldn't take care of yourself, an advance directive would be there to speak for you. I always encourage people to, even though you have an advance directive, still speak with your family and let them know what your wishes are. In cases like this, they could be able to speak for you. And not to say that Adriana did or didn't or needed to, but we see how this plays out when we don't have the voice of the patient. Everybody takes their position, and it could be what the patient wanted or absolutely not what the patient wanted. So that's something, while you're alive and well, of all ages, 18 plus, please think about these things, talk about these things, and get an advance directive so that it can speak for you in these circumstances. While I was researching this case, I was very curious on if this has happened before. Have we dealt with this before? I didn't really remember. But as I was looking, I ran across a case of Marlise Munoz. This was a case from about November of 2013 to January 2014. Mrs. Munoz had an advance directive. She did not want life-sustaining medical treatment. And her husband, Eric Munoz, spoke for her. She does not want this. However, the hospital was able to make a determination that the patient was not to come off of life-sustaining support, even though she had a brain injury because she was pregnant. So this case was taken to trial. So it sounds similar, even though we kind of knew what Mrs. Munoz's requests were. We don't really know what Adriana's requests are as the reports have come out. I'm not for sure if she spoke with her family or not, but just as far as I know at this moment. So it makes it a little bit different. And the reason why they won their case was because the fetus suffered anoxic injuries as well and would not be viable if she was to carry the pregnancy to term. So the family won, and they were able to remove Mrs. Munoz from life support. This happened in 2013 because there's been a lot of changes around abortion in the United States. This could seem like it's just a very recent, very current event, but this is something that has happened before, and I think something that we really need to clear up and understand amongst all of us so that we don't have people going through this. And speaking about brain death versus an extensive injury where you couldn't make decisions for yourself, unfortunately, an advance directive, living will would not make a difference for someone who's experienced brain death because legally they have no brain function. They are legally dead. And advanced directives covers people who still have brain function. Even though my thought was maybe this would have helped, possibly it wouldn't have helped either. I think the focus and the crux of these cases that we just talked about is that we need to have something spelled out specifically per person or legally to make sure that we are respecting the wishes of the person who is carrying the child, the family that is carrying the child, as these things are happening, and we're not making our own decisions based off of what we would want for ourselves, or, carrying out the law as we perceive it to be. In this video, we've covered the basis of the cases, who Adriana was in terms of this case in particular, what some of the legal definitions were, what some of the medical definitions were, what's happening as far as the family. So we've covered a lot. I'm going to end the video here. We're going to make this a series to kind of talk through some of the nuances about this case in particular and what happens going forward. I think that we all should take a page out of this book to, one, talk about our advanced directives, talk with our families about what we would want, and also just come to terms as a nation about what would be best for us in these situations. Speaking as human beings, not red, not blue, not in between, green, nothing, just as human beings, what makes the most sense for us as human beings in these circumstances. And please comment, subscribe, like. Let's have discourse. Let's have meaningful discourse. We don't have to agree on this situation, but it would be great if we could hear each other out. So please comment respectfully. I would like to hear your stories if this has happened to you, if you know someone that this has happened to, what your perspective is on this situation. What do you think should happen? All of those things I love to hear. I look forward to seeing the conversation in the comments. Once again, thanks for sticking with me. Look out for the other videos about this topic, and I look forward to seeing you soon. Bye.